MBLEx, Pathology, Contraindications, Area of Caution, Special Populations 85 questions. Question 1. What is frozen shoulder? A. Medial epicondylitis. B. Peritonitis. C. Plantar fasciitis. D. Adhesive capsulitis. Question 1 Answer, D. Adhesive capsulitis. Question 2. What is in lactation? A. Prolactin and oxytocin. B. Somatic pain. C. Circadian rhythms. D. Ultradian rhythms. Question 2 Answer, A. Prolactin and oxytocin. Question 3. What immune response process destroys foreign cells? A. Kyphosis. B. Fibrosis. C. Scoliosis. D. Phagocytosis. Question 3 Answer, D. Phagocytosis. Question 4. What is the lateral tilt of the spine? A. List. B. Fibrosis. C. Gibbous. D. Pain. Question 4 Answer, A. List. Question 5. What results in a decreased ability to exhale with the diaphragm and intercostals not able to work efficiently? A. Hernia. B. Emphysema. C. Epidemic. D. Kyphosis. Question 5 Answer, B. Emphysema. Question 6. What repeats themselves annually? A. Ultradian rhythms. B. Ultradian rhythms. C. Circadian rhythms. D. Seasonal rhythms. Question 6 Answer, D. Seasonal rhythms. Question 7. Is tilting of head caused by spasm in sternocleidomastoid muscle? A. Rickets. B. Peritonitis. C. Prognosis. D. Torticollis. Question 7 Answer, D. Torticollis. Question 8. What is a progressive skin condition that destroys motor neurons in the spinal cord? A. Lou-Gehrig's disease. B. Tuberculosis. C. Signs of disease. D. Legg-Calvé-Perthes disease. Question 8 Answer, A. Lou-Gehrig's disease. Question 9. Degeneration and the necrosis of the head of femur? A. Lou-Gehrig's disease. B. Crohn's disease. C. Legg-Calvé-Perthes disease. D. Symptoms of disease. Question 9 Answer, C. Legg-Calvé-Perthes disease. Question 10. What repeats themselves every few hours? A. Strain. B. Entrainment. C. Circadian rhythms. D. Ultradian rhythms. Question 10 Answer, D. Ultradian rhythms. Question 11. What is not likely to be a mode of HIV transmission? A. Pain. B. Saliva. C. Scurvy. D. Viral. Question 11 Answer, B. Saliva. Question 12. What is a coordination or synchronization to a rhythm? A. Strain. B. Trauma. C. Sprain. D. Entrainment. Question 12 Answer, D. Entrainment. Question 13. What is the examination of tissues removed from cadavers or living people for the purpose of studying disease? A. Somatic pain. B. Pathology. C. Anatomic pathology. D. Pathophysiology. Question 13 Answer, C. Anatomic pathology. Question 14. What is a deteriorating disease involving the breakdown of tissues? A. Exacerbation. B. Degenerative. C. Sprain. D. Saliva. Question 14. Answer: B. Degenerative. Question 15. What is a progressive inflammatory condition that may affect any part of the GI tract? A. Luger-Higgs disease. B. Symptoms of disease. C. Crohn's disease. D. Chronic pain. Question 15. Answer: C. Crohn's disease. Question 16. What is laboratory medicine? A. Pathology. B. Clinic pathology. C. Anatomic pathology. D. Clinical. Question 16. Answer: B. Clinic pathology. Question 17. What is persistent chronic pain? A. Visceral pain. B. Intractable pain. C. Chronic pain. D. Phantom pain. Question 17. Answer: B. Intractable pain. Question 18. What is tennis elbow, caused by repetitive extension of the wrist or pronation and supination of the forearm? A. Lateral epicondylitis. B. Medial epicondylitis. C. Plantar fasciitis. D. Peritonitis. Question 18. Answer: A. Lateral epicondylitis. Question 19. What is pain and inflammation of plantar fascia? A. Plantar fasciitis. B. Phantom pain. C. Peritonitis. D. Torticollis. Question 19. Answer: A. Plantar fasciitis. Question 20. What is incomplete break in the bone causing it to split, common in children? A. Seasonal rhythms. B. Incomplete fracture. C. Green stick fracture. D. Comminuted fracture. Question 20. Answer: C. Green stick fracture. Question 21. What is a chronic autoimmune disease and which antibodies attack various types of tissues throughout the body? A. Trauma. B. Lupus. C. Gibbous. D. Viral. Question 21. Answer: B. Lupus. Question 22. What is a physical injury or when caused by external force or violence? A. Strain. B. Sprain. C. Trauma. D. Health. Question 22. Answer: C. Trauma. Question 23. What is golfer's or pitcher's elbow, caused by repetitive flexion of the wrist as in throwing? A. Medial epicondylitis. B. Peritonitis. C. Adhesive capsulitis. D. Tenosynovitis. Question 23. Answer: A. Medial epicondylitis. Question 24. What is observed by a health professional? A. Phantom pain. B. Spina bifida. C. Signs of disease. D. Symptoms of disease. Question 24. Answer: C. Signs of disease. Question 25. What is a disease with no known cause? A. Idiopathic. B. Dislocation. C. Pain. D. Whiplash. Question 25. Answer: A. Idiopathic. Question 26. What is a complete state of well-being? A. List. B. Trauma. C. Saliva. D. Health. Question 26. Answer: D. Health. Question 27. What is the expected outcome of disease? A. Kyphosis. B. Lordosis. C. Prognosis. D. Scoliosis. Question 27. Answer: C. Prognosis. Question 28. What is the lateral curvature of the spine? A. Prognosis. B. Scoliosis. C. Torticollis. D. List. Question 28. Answer: B. Scoliosis. Question 29. What is caused by A. Pathogen that can grow after infected host cell? A. Viral. B. Saliva. C. Hernia. D. Anomaly. Question 29. Answer: A. Viral. Question 30. What is capable of being transmitted with or without contact? A. Dislocation. B. Inflammation. C. Tinnitus. D. Infectious. Question 30. Answer: D. Infectious. Question 31. What is an infectious disease that attacks many people at the same time? A. List. B. Bacterial. C. Epidemic. D. Emphysema. Question 31. Answer: C. Epidemic. Question 32. What is inflamed mucous membrane that lines abdominal cavity? A. Peritonitis. B. Torticollis. C. Tinnitus. D. Lordosis. Question 32. Answer: A. Peritonitis. Question 33. What is the bone and the skull being driven inward? A. Simple or closed fracture. B. Compound or open fracture. C. Degenerative. D. Depressed fracture. Question 33. Answer: D. Depressed fracture. Question 34. What is more than one fracture line, with several fragments resulting in much soft tissue damage? A. Compound or open fracture. B. Congenital. C. Acute pain. D. Comminuted fracture. Question 34. Answer: D. Comminuted fracture. Question 35. What is a disease present at birth? A. Congenital. B. Clinical. C. Fungal. D. Bacterial. Question 35. Answer: A. Congenital. Question 36. What is a deviation from normal? A. Viral. B. Etiology. C. Saliva. D. Anomaly. Question 36. Answer: D. Anomaly. Question 37. What is likely to be a mode of HIV transmission? A. Anomaly. B. Breast milk. C. Epidemic. D. Homeostasis. Question 37. Answer: B. Breast milk. Question 38. What is overdeveloped thoracic curve? A. Lordosis. B. Kyphosis. C. Prognosis. D. Pain. Question 38. Answer: B. Kyphosis. Question 39. What is a widespread epidemic? A. Bacterial. B. Epidemic. C. Pain. D. Pandemic. Question 39. Answer: D. Pandemic. Question 40. What is an angular deformity of a collapsed vertebrae? A. Saliva. B. Fungal. C. Rickets. D. Gibbous. Question 40. Answer: D. Gibbous. Question 41. What is a break in the skin and torn soft tissues, where the bone protrudes through the skin? A. Depressed fracture. B. Green stick fracture. C. Compound or open fracture. D. Simple or closed fracture. Question 41. Answer: C. Compound or open fracture. Question 42. What is the loss of function of wrist and fingers? A. Acute pain. B. Injury to ulnar nerve. C. Inflammation. D. Carpal tunnel syndrome. Question 42. Answer: B. Injury to ulnar nerve. Question 43. What is able to walk or not confined to a bed? A. Etiology. B. Pathology. C. Ambulatory. D. Subluxation. Question 43. Answer: C. Ambulatory. Question 44. What is the tendency for oscillating bodies to move in a synchronized, harmonic manner, the coordination or synchronized to a rhythm? A. Strain. B. Sprain. C. Entrainment. D. Trauma. Question 44. Answer: C. Entrainment. Question 45. What is a hole or rip in the abdominal wall? A. Strain. B. Viral. C. Health. D. Hernia. Question 45. Answer: D. Hernia. Question 46. What is ringing in the ears? A. Rickets. B. Hernia. C. Tinnitus. D. Congenital. Question 46. Answer: C. Tinnitus. Question 47. What is the study of all factors involved in causing a disease? A. Epidemic. B. Etiology. C. Viral. D. Ambulatory. Question 47. Answer: B. Etiology. Question 48. What is an inflammation of the tendon sheath? A. Tenosynovitis. B. Phagocytosis. C. Congenital. D. Lordosis. Question 48. Answer: A. Tenosynovitis. Question 49. What is the reaction to repeat exposure to stimuli that can explain the automatic reaction to massage? A. Toughening, hardening. B. Hernia. C. Chronic pain. D. Acute pain. Question 49. Answer: A. Toughening, hardening. Question 50. What is a disease caused by molds or yeast? A. Hernia. B. Fungal. C. Viral. D. Anomaly. Question 50. Answer: B. Fungal. Question 51. What is on a 24-hour clock? A. Tinnitus. B. Idiopathic. C. Seasonal rhythms. D. Circadian rhythms. Question 51. Answer: D. Circadian rhythms. Question 52. What is caused by tiny cells that secrete toxins, eat body cells, or form colonies? A. Bacterial. B. Viral. C. Congenital. D. Pandemic. Question 52. Answer: A. Bacterial. Question 53. What is pain from an amputated limb? A. Chronic pain. B. Acute pain. C. Phantom pain. D. Somatic pain. Question 53. Answer: C. Phantom pain. Question 54. A development problem in which the vertebral arches do not fuse into spinous processes? A. Epidemic. B. Saliva. C. Spina bifida. D. Strain. Question 54. Answer: C. Spina bifida. Question 55. What is short-lived and is localized unpleasant feeling? A. Somatic pain. B. Phantom pain. C. Clinical. D. Strain. Question 55. Answer: A. Somatic pain. Question 56. What is the study of functional or physiologic changes in the body that result from various disease processes? A. Pathophysiology. B. Etiology. C. Emphysema. D. Pathology. Question 56. Answer: A. Pathophysiology. Question 57. What is a breaking a bone that does not break the skin or injure soft tissue? A. Simple or closed fracture. B. Comminuted fracture. C. Spiral fracture. D. Compound or open fracture. Question 57. Answer: A. Simple or closed fracture. Question 58. What is tear in ligaments? A. Strain. B. Sprain. C. Saliva. D. Scurvy. Question 58. Answer: B. Sprain. Question 59. What is an unpleasant subjective sensation? A. Sprain. B. List. C. Lupus. D. Pain. Question 59. Answer: D. Pain. Question 60. The partial displacement of bones of the joint? A. Pain. B. Subluxation. C. Strain. D. Scoliosis. Question 60. Answer: B. Subluxation. Question 61. What is an overdeveloped lumbar curve? A. Epidemic. B. Lordosis. C. Scoliosis. D. Lupus. Question 61. Answer: B. Lordosis. Question 62. What is the study of nature and causes of disease as related to structure and function of a body? A. Pathology. B. Ambulatory. C. Anomaly. D. Pathophysiology. Question 62. Answer: A. Pathology. Question 63. What is founded on at school observations and treatment? A. Congenital. B. Saliva. C. Clinical. D. List. Question 63. Answer: C. Clinical. Question 64. What repeat themselves annually? A. Circadian rhythms. B. Seasonal rhythms. C. Ultradian rhythms. D. Ultradian rhythms. Question 64. Answer: B. Seasonal rhythms. Question 65. What is cervical acceleration deceleration injury? A. Pain. B. Rickets. C. Whiplash. D. Viral. Question 65. Answer: C. Whiplash. Question 66. What is a break in which the bone twisted apart? A. Incomplete fracture. B. Green stick fracture. C. Spiral fracture. D. Spina bifida. Question 66. Answer: C. Spiral fracture. Question 67. What is a formation of scar tissue? A. Kyphosis. B. Fibrosis. C. Prognosis. D. Tinnitus. Question 67. Answer: B. Fibrosis. Question 68. What is an unpleasant sensation from an internal organ? A. Phantom pain. B. Visceral pain. C. Acute pain. D. Somatic pain. Question 68. Answer: B. Visceral pain. Question 69. What is a group of signs and symptoms that identify a condition? A. Syndrome. B. Saliva. C. Strain. D. Scurvy. Question 69. Answer: A. Syndrome. Question 70. What is caused by a vitamin C deficiency? A. Saliva. B. Scurvy. C. Hernia. D. Viral. Question 70. Answer: B. Scurvy. Question 71. What is the increase in the severity of a disease? A. Dislocation. B. Bacterial. C. Inflammation. D. Exacerbation. Question 71. Answer: D. Exacerbation. Question 72. What is the described problems and diseases describe the patient? A. Kyphosis. B. Symptoms of disease. C. Somatic pain. D. Scoliosis. Question 72. Answer: B. Symptoms of disease. Question 73. What is caused by vitamin D deficiency? A. Viral. B. Rickets. C. List. D. Clinical. Question 73. Answer: B. Rickets. Question 74. What is injury to a muscle? A. Sprain. B. Pain. C. Strain. D. Trauma. Question 74. Answer: C. Strain. Question 75. What is a displacement of bones of the joint? A. Idiopathic. B. Inflammation. C. Dislocation. D. Strain. Question 75. Answer: C. Dislocation. Question 76. What is a break that does not go across the entire bone? A. Comminuted fracture. B. Green stick fracture. C. Depressed fracture. D. Incomplete fracture. Question 76. Answer: D. Incomplete fracture. Question 77. What repeats themselves every few hours? A. Trauma. B. Entrainment. C. Seasonal rhythms. D. Retradian rhythms. Question 77. Answer: D. Retradian rhythms. Question 78. What is a temporary pain after an operation? A. Bacterial. B. Somatic pain. C. Acute pain. D. Sprain. Question 78. Answer: C. Acute pain. Question 79. What is an unpleasant feeling that lasts over 6 months? A. Sprain. B. Chronic pain. C. Hernia. D. Somatic pain. Question 79. Answer: B. Chronic pain. Question 80. What is the relative constant state maintained by the physiology of body maintained by the sympathetic and parasympathetic systems working together? A. Homeostasis. B. Scoliosis. C. Prognosis. D. Lordosis. Question 80. Answer: A. Homeostasis. Question 81. What is a median nerve of brachioplexus injured by compression through the carpal tunnel? A. Carpal tunnel syndrome. B. Injury to ulnar nerve. C. Circadian rhythms. D. Seasonal rhythms. Question 81. Answer: A. Carpal tunnel syndrome. Question 82. What is heat, redness, swelling, pain, and is a tissue injury that causes this? A. Inflammation. B. Subluxation. C. Dislocation. D. Exacerbation. Question 82. Answer: A. Inflammation. Question 83. What is like hibernation? A. Conservation withdrawal. B. Somatic pain. C. Circadian rhythms. D. Entrainment. Question 83. Answer: A. Conservation withdrawal. Question 84. What is on a 24-hour clock? A. Spiral fracture. B. Chronic pain. C. Ultradian rhythms. D. Circadian rhythms. Question 84. Answer D. Circadian rhythms. Question 85. What is highly contagious airborne disease from a bacterial infection that only begins in the lungs? A. Fibrosis. B. Tuberculosis. C. Prognosis. D. Torticollis. Question 85. Answer B. Tuberculosis.